Hello, this is Dr. Stanley Lang, and welcome to this presentation on low inflammation eating and heart disease. And the reason that I'm presenting on this topic today is because of three different patients that I saw today that this is really relevant to. First of all, I saw a patient who had an elevated test that's called a high sensitivity CRP test. And this is a marker for microinflammation, which we think reflects inflammation of the coronary arteries. And I gave him three different options for trying to lower his risk because he was in the high risk category for this test. He was otherwise very healthy looking for his age. He was doing quite a bit, had not the slightest hint of any heart problems, but his CRP test suggested that he had a high risk of a heart attack happening in the next couple of years. So I wanted to let him know that one of the ways to address that elevated CRP was to eat a low inflammation diet. The other options were for him to use high doses of broad spectrum antioxidants, and the third option to lower that test is a statin drug, which I did not recommend for him. That is, I didn't recommend the third option. Now, the second patient that I saw had just had open heart surgery, had 4 different blood vessels bypassed during the surgery. And for the last 2 years, I have had conversations with this patient about the need to get on the stick to change lifestyle because she was eating in a way that was increasing inflammation of the arteries. And the patient was somewhat interested, but not interested enough to make any major changes. Now, with this heart surgery done, you would think that there would be more of a sense of urgency, yet this patient still doesn't feel a lot of urgency to learn how to eat in a low inflammatory way. Now, getting back to the first patient, one of the things that happens by eating low inflammatory is to decrease your risk for heart disease, for a cardiac event, because it decreases the amount of inflammation that's going on in the arteries and in the plaque that's in the arteries. So the plaque is less likely to rupture when it is less inflamed, and ruptured plaque is what triggers most heart attacks. And this patient had good reason to get involved, yet was moderately interested, not particularly wanting to make a lot of changes. Already thought that enough was being done. The third patient that I saw was a very obese person who had just had blood clots in his leg that had gone to his lung. Now, that's a completely different condition than coronary artery disease, yet the risk factors are exactly the same. And the high sensitivity CRP test actually shows an increased risk for that kind of event also, because it basically is just showing inflammation of the vessels in the body. This patient was very interested in a low inflammation eating plan because he had been sufficiently frightened. See, the other two patients had not been sufficiently frightened. They had not been moved from a point of relative emotional comfort to a point of, gee, I got to do something about this. And that's a problem for a lot of us because we are complacent. We take things for granted. We assume that we've got future options, yet 50% of people that die from a heart attack drop dead. They don't have a chance to be resuscitated. They drop dead outside of the hospital. And so there's not a second chance for those people. And for all of us, as we get older, we have some substantial risk for having a heart attack because that's still the leading cause of death. And our lifestyles and the foods we eat, the chemicals we're exposed to, lots of different reasons that we increase the inflammation in our bodies by how we eat. Now, the thing that we talked about today the most was eating low glycemic. That means eating in a way that doesn't raise the blood sugar quickly. And I teach you how to do that in a lot of detail in a free ebook that I'd love to give you if you click on the link below this or to the side of this video, which is called Why Am I Still Fat? And that will teach you how to eat low glycemic. Now, there's a lot of other issues that are involved in eating that also increase inflammation. So there are chemicals in the food that badly damage the small bowel, make it leaky, which increases inflammation. And learning how to eat to avoid those foods is really critical also. But the focus of this particular presentation is on low glycemic eating, which all by itself will dramatically decrease inflammation. So if you're interested in making a change in your life, I strongly encourage you to do so, because it will make a big impact on how you feel, but also how you function and your future risk for multiple diseases, not just coronary artery disease. So every chronic condition known to us is aggravated by eating in a high inflammation eating strategy, which is the typical American diet. So as always, the strategies that I recommend are in the context of a whole person health approach to our wellness. That's health of body, mind, and spirit. And when we focus on all three of these spheres, we have the highest chance of being as healthy as possible. And one of the main reasons for that is that each one of these spheres contributes to how much stress we're experiencing. The more stress, the more disease, the more dysfunction. So I encourage you to approach life in a holistic health approach. It's the best way going forward. I wish you well. I encourage you to pick up that free ebook. God bless and have a great day.